this video, we'll discuss how Black maternal mortality is a disparity affecting many and what ways we can help to reduce them. Let's start off by introducing what this is. Maternal mortality can be best described as mothers passing away from complications due to pregnancy and childbirth. The rate of maternal mortality is done by dividing maternal deaths in a year over live births and then multiplying by 100,000. Black maternal mortality is a disparity where Black mothers are disproportionately affected by higher rates compared to white or Hispanic mothers. This is a problem for public health officials, as it raises the question of why Black mothers are affected in the first place. Unfortunately, we see disparities in access to healthcare, the quality of healthcare, as well as affordability of healthcare that affects mothers' abilities to visit their physicians to get frequent checkups. According to the CDC, Black women are 3 times more likely to die from a pregnancy-related cause than white women. Multiple factors contribute to these disparities, such as variation in quality healthcare, underlying chronic conditions, structural racism, and implicit bias. Having access to frequent quality care will ensure mothers are being checked for complications and will help to reduce these maternal mortality rates. Multiple organizations have taken action to address the disparities faced by Black women and promote changes within the U.S. healthcare system. This is seen at various levels of our society, from the community to the government. For example, the Black Maternal Health Caucus promoted awareness and change federally for Black maternal health through African American U.S. Congress members. It is critical for those experiencing inequalities to have the opportunity to voice their concerns, and having a body of mainly Black women makes these efforts more efficient. Black Mamas Matter Alliance is an advocacy group consisting of Black women who are experts and activists with concerns about Black maternal health care, Black mental health, and racial inequalities experienced by Black people as a whole. The MMA provides Black women and mothers opportunities to speak on personal experiences of unjust treatment within healthcare through organizing conferences, summits, and community events. Through these gatherings, they are able to promote dialogue and share research findings. Topics focused on consist of access to social support, financial opportunities, and more stable living environments. Through a joint research study, BMMA acknowledges and quotes, drivers of maternal mortality in the U.S. include social determinants of health, such as poverty and lack of health insurance. Black women are at higher risk of these circumstances, placing them at a greater disadvantage. Being that there are many factors playing into Black maternal mortality, it is important to advocate for change all around. BMMA has a great social media presence, and the tactics they use to promote their works have shown positive feedback and support. Their approaches could be implemented within a new plan through organizing different chapters across the states in highly populated areas with a large Black population. These chapters can hold different events, targeting and proposing new ideas within these communities. Events could be working on financial literacy, teaching sexual and reproductive health, job fairs, activities for women and families, and health screenings. Each chapter can have accounts on platforms like Twitter, Instagram, and Facebook to publicize latest and upcoming works. They can organize events nationwide on specific days or during national weeks, such as Black Maternal Health Week. Having the ability to announce and interact in a widespread area attracts people to the cause, promotes change, and showcases the reality of how many are at risk of experiencing these disparities. Anyone interested in being involved can contact BMMA at blackmamamasmatter.org, as well as the Black Maternal Health Caucus on Twitter at @BMHCaucus. After examining what maternal mortality is and how it affects Black mothers, the most efficient solutions come in the organizational and policy level of the socio-ecological model. In the policy level, maternal mortality is encompassed by public versus private health insurance, inadequate and inequitable social policies, reproductive injustice, and structural racism and discrimination. This is the level that can trickle down and solve the issues presented in the organizational level. The organizational level of this model encompasses the low quality of care in Black-serving hospitals, implicit racial bias in healthcare, limited preventive and preconception care, and the one-size-fits-all prenatal care models that were made based on white bodies rather than those of women of color. Our solution would then be to introduce a public health policy in the form of a bill that provides aid and funding aimed towards expanding Medicare coverage, providing public health racial sensitivity infrastructure, and providing sexual health education for high school-age people. As mentioned, Black Mamas Matter Alliance is largely the influence for what this solution is and aims for. This policy solution is an attempt to achieve the goal of one day reducing the disparity in Black mothers. With that being said,